Hello, I'm Abigail Martinez.
And I'm Lisa Wetron. And today we will be laser focused while shining a light on nicotine cessation.
Have you seen the light? According to the CDC, the rate of successful smoking cessation is as low as 7.5%. Many studies have shown using cold lasers with certain wavelengths can aid in increasing the chance of nicotine cessation. This cold laser is within 405 to 904 nanometers with a beam area of zero point 0.3 centimeters squared. It delivers energy of 7.2 joules per centimeter squared when used for laser acupressure. The laser is able to stimulate the release and production of dopamine and serotonin during phases of withdrawal, thereby affecting the limbic system, also known as the brain's reward system. In order to stimulate this, the low-level laser sends frequencies through 5 auricular acupressure points called the Shenman, sympathetic, kidney, liver, and lung. Other smoking cessation approaches like nicotine gum expose habitual users with about 2 to 4 milligrams of nicotine, thereby re-exposing the addictive chemical. We identified laser therapy by a personal case study that proved to be beneficial and effective. Methods. We did an evaluation of systematic literature reviews for laser therapy and its effects for successful smoking cessation done within the last 5 years.
From the article, Efficacy of Laser Auricular Acupuncture for Smoking Cessation, we have Fagerstrom scores showing the amount of nicotine dependence per group pre and post treatment. Group 1 received laser therapy only. Group 2 received psychological counseling only. And Group 3 received both laser therapy and psychological counseling. In all three groups, there was an average of a 50% reduction in nicotine dependence after they completed their treatments. In our second graph from the article Role of Auricular Laser Acupuncture and Psychological Counseling in Reducing Nicotine Dependence Due to Smoking, we have the percentage of cessation and retreatment results graph. There were a total of 175 patients that smoked at least one pack of cigarettes a day. They all successfully completed 7 auricular laser acupuncture sessions over a 3-week period. Out of 175 participants, 149 quit smoking after 7 sessions. 21 still smoked 1 to 2 cigarettes after treatment due to habit. 5 participants smoked more than 3 cigarettes after treatment due to stress. Out of the 175 participants, 12 needed maintenance sessions after 3 months, but all 175 were successful in at least reducing their nicotine intake, if not eliminating nicotine completely. In our third graph, from the efficacy of laser auricular acupuncture for smoking cessation, the visual analog scale tracked their irritability, tiredness, calmness, anxiety, cravings, unpleasant taste while smoking, headache, ability to concentrate, and appetite before treatment and after treatment. Within the 3 groups, the most significant changes were major reduction in cravings and unpleasant taste while smoking. Group 1 received laser therapy only. Group 2 received psychological counseling only. And Group 3 received psychological counseling and laser therapy combined. Group 1 had the most significant reduction in cravings and unpleasant taste while smoking, with a reduction of about 50%.
Analysis. Participants in multiple studies have either successfully quit the intake of nicotine or notably reduced their intake amount. However, more studies are necessary for replication to understand what methods work best. Laser therapy alone and laser therapy combined with psychological counseling are both known to be effective for smoking cessation. The addition of counseling may help people who are not motivated to quit, and those who are mentally and physically ready to quit smoking have a greater chance of smoking cessation and behavioral change. Advancing our scope of practice. Dental professionals should recognize that nicotine use greatly affects oral and systemic conditions. Therefore, dental professionals should be including laser therapy into their scope of practice. Expanding our scope will aid in bringing awareness of the laser therapy nicotine cessation method can boost confidence and motivation to quit, and connect our patients with cost-effective, non-invasive, and painless treatments that eliminate the exposure of nicotine.
This subject is very personal to me. I smoked 1.5 to 2 packs of cigarettes a day. On November 16th, 2005, I ended a 10-year toxic relationship with cigarettes when I completed laser therapy treatments. My session lasted 60 minutes and was relatively painless. I left feeling like I was floating on a cloud from all the endorphins that were coursing through me. This feeling lasted 3 to 4 days, and I never had another cigarette. The cravings and urges were gone. My sense of smell and taste had already begun to change. The burning of cigarettes smelled awful, and I realized that I was adding way too much salt to my food. Almost 19 years later, and I am still nicotine free, and I am forever grateful for laser acupuncture therapy. In conclusion, we will continue to advocate and search for advancements in our scope of practice. Thank you for listening.